Hello, my name is Margaret Ballard and I'm a student at Eastern Kentucky University in the Rural Family Nurse Practitioner program. Today, I am presenting on the topic of concussions in youth athletes as it pertains to an integrative review of studies examining interventions for the issue. The incidence of concussions among youth athletes has been on the rise in the United States. The Centers for Disease Control and Prevention have found that the rate of emergency department visits among children, age 19 or younger, more than doubled between 2001 and 2012 for sports and recreation-related injuries with a diagnosis of traumatic brain injury or concussion. In response to this healthcare crisis, the CDC has created an initiative known as Heads Up to Youth Sports that provides information on preventing, recognizing, and responding to concussions for parents, athletes, and the coaches. This program was implemented on the national level in efforts for the most part to prevent concussions in youth sports. In light of this health issue, I conducted an integrative review of a Level 1, Level 2, and qualitative study that examined interventions being implemented in current practice for treatment of sports-related concussions in youth athletes. The Level 1 study I analyzed was by Schneider and Associates in 2017, and it was a systematic review of studies evaluating rest and treatment rehabilitation of concussions. The age range that accounted for the majority of participants was 11 to 30. Post-concussion syndrome following a sports-related injury was being treated by either extended rest of 5 to 7 days or a shorter rest period of 24 to 48 hours, followed by a variety of active rehabilitation interventions and programs. The findings of the systematic review support that there is a better outcome for youth athletes with concussions with a treatment plan including active rehabilitation. A randomized control trial conducted by Chan and Associates in 2018 evaluated 19 adolescents that were in active rehabilitation for treatment of persistent post-concussion symptoms. The primary aim of this study was to assess the safety of this intervention. The randomized control trial showed that a significant effect supported active rehabilitation and treatment of concussions as a safe intervention. In the qualitative study performed by Hunt and Associates in 2018, a survey was given to youth athletes and their parents after a 6-week active rehabilitation program. The data collected from these surveys was analyzed, and the findings offered useful evidence in individualizing active rehabilitation programs for youths with concussions to optimize the outcomes for these individuals. The significance of the findings of the integrative review offers support to those in the nursing practice aiming to advance care for youth athletes that have suffered a sport-related concussion and post-concussion symptoms. Nurses are an integral part of patient advocacy, and they are in a place to encourage and implement active rehabilitation for these patients. The integrative literature review supports implementation of shortened rest periods of 24 to 48 hours, followed by active rehabilitation, which includes aerobic exercise and physical therapy, and can result in better outcomes for youth athletes that suffer from a sport-related concussion. The most appropriate setting that the evidence in this review can be applied to is potentially an outpatient clinic that specialized in concussions and/or sports injuries, where an advanced practice nurse would be serving the population. Thank you for listening to this presentation of an integrative review on the topic of active rehabilitation and the treatment of concussions.